happen to have this nice articulated pelvis here. Okay? Everything below my hand is true pelvis, meaning that these parts of the pelvic bones are actually down in the pelvic cavity. So everything below here, this is true pelvis. These big wings up here, this is false pelvis. These are your big hip bones. They're way up here in your abdominal cavity. So we call that false pelvis. Okay? And they talk about inlet, outlet. Inlet means looking at it this way. Outlet means looking at it this way. And if that outlet is greater than 90 degrees, if this angle here is greater than 90, it's a female pelvis. For the babies. Right? It's a much wider angle in females.
Is that one a female?
And a much wider opening here. What? These are all males. These are all male skeletons we have here. Okay, they're not going to ask you that inlet, outlet, true, false, but just so you know. Okay. Okay, so if we look at the two halves of your pelvis, and these are held together by the sacrum, right? The sacrum holds them together. Okay. And we said right and left. If you can talk to them like a phone, right? Right and left. Each one of these is called an os coxa. Half of your pelvis is an os coxa. Okay? So now your os coxa is actually comprised of 3 different bones that fuse together when you're in your 20s. The big one up here is the ilium. The one in the back here is the ischium. And the one in the front here is the pubis. Okay? So if we just look at the ilium for a minute. This ridge right here, this is the iliac crest, or the iliac tuberosity. We'll take either one of them. Okay? Here. And then they want you to identify the spines on the ilium. Okay? They want the anterior superior spine. So this is the front, right? So this is the front. This is superior. So this is the anterior superior iliac spine. This is the anterior inferior iliac spine. On the back, this is the posterior superior iliac spine. This is the posterior inferior iliac spine. Okay, just the bumps. All right. What else? Where am I? Ilium. You don't have to worry about the tuberosity, but you do need to know the auricular surface, which is this irregular area right here where the sacrum articulates. Okay. And then if we look on the outside here, you have this big indent here. That's called the acetabulum. That's where the head of the femur is going to articulate. The femur sits right in here. Okay? The acetabulum. It's up here. Okay, you don't have to worry about the acetabular notch, which is supposed to be this little thing right in the middle. If they put a number in there and they want you to identify, you just say acetabulum. It's fine. Okay? Okay. So now we're going to look at ischium. Ischium is this bone in the back. Okay, this is the ischium. Okay, and they want the ischial spine. Well, there's only one spine on the ischium. There's only one thing poking out on the ischium. That's the ischial spine. Okay. All right. And then they want the ischial tuberosity. This is the part coming around the corner here. This rough part here on the bone. That's the ischial tuberosity. Okay, and then the part coming up here, this is the ramus of the ischium. Just like the ramus of the jaw, remember the part that angles up? This is the ramus of the ischium right here. Okay, right, and now we're going to do the pubis, which is the bone in the front. So again, this would be the superior ramus up here. This would be